This starts with sensitive mouth care, oral colostrum and skin to skin. It should be a positive experience, a time for bonding and communicating with your baby, being close to each other and learning what each other needs. Your baby's ability to feed for themselves will develop over time as they become more mature or recover. No 2 days are the same. It's a journey and can be influenced by several things. It takes time and patience. Some of the things you may notice your baby doing are waking early for feeds, sucking their fingers or bedding, turning their head and rooting, opening their mouth and searching. This is very individual. It depends on how well your baby is and what help they need with things such as breathing, and also how mature they are. Things you can do to support your baby. Use your milk for mouth care. Offer your baby milk when having a procedure, and skin to skin. If your baby is having skin to skin and you notice these behaviours, you can support your baby to have a nuzzle at the breast. Your nurse can help you to position your baby so they can lick the breast and attach if they are wanting to do so.
Feeding is about communicating and listening to what your baby is telling us. Going at baby's pace and responding to their needs is called responsive feeding. In hospital, we modify this to the needs of your baby and we discuss a feeding plan with you. Hold baby close and in a straight line so they are not turning their head to reach the breast. Line them up with their nose next to your nipple. Your baby will open their mouth and pull their head back. When they do this, gently move them onto the breast while their mouth is wide open. This will help them get as much of your breast in their mouth as possible and not just the nipple. Your baby may stay in this position, so make sure you are sitting comfortably. At first, they may move off the breast quickly or fall asleep straight away. This is normal, but a very positive experience for you both. In time, they will be able to maintain this for longer and you may feel them suckling. Baby should be close to you with their chin touching your breast. Their mouth should look wide open and their cheeks full. If their cheeks are hollow, like they are sucking on a straw, they do not have enough breast in their mouth and are probably just on your nipple, which will make you sore. You may notice more of your areola, the dark area around your nipple, above the baby's lip rather than underneath. You may be able to hear and see your baby swallowing. It shouldn't hurt, although some mums may feel a painful sensation at first, which should not last. At first, your baby may not take much, if any, milk directly from the breast. They will still have a feeding tube in place in their nose and will receive their milk through the tube after they have tried at the breast. Remember, it is a gradual process and it is tiring for your baby. Are they attached correctly? Can you see them swallowing? How does it feel? In time, your breasts may feel less full after a feed, and we would encourage you to empty them with the breast pump. After trying your baby at the breast, you may notice you get less milk when you pump as your baby starts to take more from the breast. Do they fall asleep at the breast or settle afterwards? Or do they still appear hungry? To start with, they will need to still have milk down their feeding tube as they are unlikely to take enough themselves. We use a time guide to help us determine how much milk to give with the tube feed. We will give you this chart as a guide. All babies and mummies are unique, and how much milk you produce and how quickly your baby removes this will be individual to you. Look out for wet and dirty nappies. What goes in must come out, and your baby will be weighed regularly. It can be difficult to make this transition, especially when you are familiar with giving set amounts of milk through the feeding tube. Do not worry, your baby will let us know if they are hungry and can be topped up as necessary. Your confidence will grow as your baby does. Your baby is getting so much more than food by feeding from you. Remember, your baby may want to go to the breast to be close to you and for comfort, not just for food. We are here to guide and support you throughout this.